For the next issue in children we should be looking at is ventricular septal defect. Ventricular septal defect. So for this ventricular septal defect, and we have it like this, it just simply means normally the ventricles down, look at this, okay, the ventricles down, normally there should be a fence between them. They shouldn't have a connection. But when you're having a connection between the ventricles, that means you're now having a mixture of oxygenated blood and deoxygenated blood. That's what they call the ventricular septal defect. Okay, so what we have here is the most common heart congenital issue. It involves a hole in the septum. That's the wall separating the left and the right ventricles of the heart. So the defect allows oxygen-rich blood from the left ventricle to mix with oxygen-poor blood in the right ventricle. So it leads to what? There's increased blood flow to the lungs. Do you understand? So it's straining the heart. Of course, straining the heart in the sense that, so minus this safe, the oxygenated blood can also be reaching tissues, including the heart. So even the heart itself is not getting sufficient oxygen supply. Okay. So types of it, you have the perimembranous, which is near the heart valves, upper septum. Have the muscular, is the lower muscular part. Have the subpulmonary, is just below the pulmonary valve. Have the inlet, that's near the tricuspid and the mitral valve. This is a baby affected by this, and you can see how the baby is in so much distress. So symptoms in children is if it is too small, there's no symptoms. That's if the opening is too small, all right. But if there's large openings, they are struggling to breathe. There's poor feeding, weight gain. They are sweating during feedings. They are weak. Okay, they have a lot of respiratory infections, and the heart is beating up normally. Okay, I've explained this, right? So diagnosis is echocardiogram, chest x-rays, ECGs, cardiac catheterizations. You just want to all right, pick it up. So treatment is small ones, they can just close on their own later on. Okay, but you should always monitor that baby. So medications like diuretics, angiotensin converting inhibitors, enzyme inhibitors, all right. Then digoxin to manage heart failure. Okay, surgical repair, where they open up, you correct the opening. Okay, catheter based closure. Okay, so guys, that's it. Okay, that's it for ventricular septal defect.